Thank you so much for visiting Nursing Embassy. Welcome to my channel. If this is your first time to visit, I'm Nurse Bosco and I usually help people with Nclex. On this channel, we do it together, we review together, and we inspire each other, knowing that we are going to make it in this exam. So today we are going to cover ventilator alarms. You may have a question on your Nclex that is like, you have a patient who is on a ventilator and it is showing low pressure alarm or high pressure alarm. What is the likely cause of the problem? Today that's what we are going to answer, guys. And yes, if you are watching today, just know that I have recorded this video on Easter. So happy Easter, guys. Happy Easter to all of you who are watching from wherever you are watching. My friends from India, my friends from Kenya, Canada, United States, Uganda, everywhere you are watching from, just know you are welcome. And remember to subscribe to this channel so that we can grow this community of us who inspire each other to achieve it in life. Guys, stay around. I'm coming shortly. Ventilator is actually a machine that is used to ventilate, okay, if I can call it like that, to pump air, oxygen into the patient's airway. So this is my water bottle, and the ventilator has a tube that you are going to take as if it's this water bottle of mine. So that tube is put in the patient's airway, and air is pushed into the patient's airway. Okay, so depending on the problems that may occur along this circuit as air flows into the patient's airway, we may get what we call a low pressure alarm or a high pressure alarm. Okay, so the ventilator is pushing in the air. So imagine what would happen if I would bite if I, the patient, would bite on this tube, like okay, assuming this was flexible enough like a tube, it would really mean that the ventilator is going to have a hard time pushing that air in the patient's airway, and that will cause a high pressure alarm because the ventilator is really using a lot of pressure to push air into that patient. And what if there is a hole, someone came and cut a hole around here? It would mean now the ventilator is using low pressure. It needs little effort for the ventilator to push the air. Not that this air is going into the patient's airway, but it's just leaking somewhere in the circuit. Okay, so I now assume that you have an idea of what it really results from, what low pressure results from, and what high pressure results from, just using this example of my water bottle. So let me now take you to the ventilator itself and show you these tubes. Okay guys, so this is the ventilator. This is the machine that is used to help us in oxygenating the patient by transfer of oxygen from its own system to the patient's airway. So as you can see, it has a screen here. Here we can adjust several settings like IE ratio, like the ventilator mode itself, like the tidal volume, and other many settings. I think I should get one time, and I help you to understand some of these things on the ventilator. However, the objective of today's video is to really take you through what causes low pressure alarm and high pressure alarm. So this is the tube. These are some of the tubes. All these tubes, we refer to them as the ventilator circuit. So one of these tubes is going to go straight to the patient. As you can see, it will go straight to the patient to deliver oxygen to that patient, and then somewhere carbon dioxide will be eliminated so that the patient's cells keep adequately oxygenated. Okay. So this is where, at this point is where we shall connect our ventilator, meaning that oxygen shall come from a tube somewhere, and that tube shall connect here to this other tube, also commonly called the endotracheal tube. As you can see, it is really going up to the trachea. So this tube somewhere here is has something like a bulb that we can inflate so that it fits tightly within the patient's trachea. Sometimes this tube can deflate, which can also lead to a low pressure alarm. Okay, so you can see now here that the patient is connected. The tube from the ventilator is coming and is connected to the endotracheal tube, or the patient's airway. So when the ventilator pushes in this air, it comes straight to the patient's airway. And so let us therefore learn about what can cause the high pressure alarms. Like I said before, high pressure alarms result from the narrowing of the tube somewhere. If there is a narrowing of that root, of that road where the air passes into the patient's lungs, then we shall have what we call a high pressure alarm. So as you can see, if that tube gets kinked, it means it will narrow the pathway of air. Then if there is condensation, for example, water has condensed within the circuit tubing, you see there is a lot of water in the tubing, and it will also narrow the airway, and that will lead to a high pressure alarm. If the endotracheal tube itself has kinked, now this time not the ventilator tubing, but the endotracheal tube. As you can see, this is the ventilator tubing, but now this is the endotracheal tube, the tube that actually enters the patient's trachea. And then the obstruction, for example, if there is too much secretions in the tube, that will also lead to a high pressure alarm. Other causes include biting the endotracheal tube. I think that would be obvious by now. You understand why. Increased airway resistance, for example, if there is bronchospasm or excessive secretions. Anything that can reduce that pathway of air, that can reduce the diameter that is meant for air to pass through, can lead to a high pressure alarm. And then if there is decreased lung compliance, the lungs of the human the lungs are able to expand and contract in response to air entry. So in conditions like pneumothorax, atelectasis, pulmonary edema, acute respiratory distress syndrome, there is reduced lung compliance, which can actually lead to a high pressure alarm on the ventilator. Then sometimes there is what we call this phenomenon called ventilator desynchrony. For example, the patient is not breathing in harmony with the ventilator. As the ventilator is pushing in the air, the patient is breathing out, and that can come from states such as anxiety, too much pain, or coughing. So that causes desynchrony and can lead to a high pressure alarm. And then sometimes you may get an alarm on the ventilator that shows low pressure alarm. Check the circuit and check the system, both the ventilator and the patient's airway or the endotracheal tube, to find out if there is any of these problems. For example, is there tubing disconnect or leak? Is there any leak within the tubing? Okay, you remember on my water bottle I said if there is any leak, it's easy for the ventilator to push that air into the system. However, it doesn't mean that the air is going into the patient's airway, and yes, it will be pushed at a lower pressure than it's supposed to be, or that is already set on the ventilator. Then endotracheal or tracheostomy tube cuff leak. For example, if there is deflation, let me show you the cuff, the tracheostomy tube cuff. I showed it here. This is the tracheostomy or endotracheal tube cuff. Sometimes it can leak or it can deflate. If the air, you see, we push air through this cuff through here, and that air is helping us to make this tubing fit well within the trachea. So sometimes that air can come out, which we call deflation, and that will lead to a low pressure alarm. Okay, so, and sometimes there is loss of airway, total loss, or partial extubation or decannulation. So what happens actually is that there happens sometimes when the patient can remove this altogether, and other mechanisms. Maybe we as nurses, we are turning the patient, and somewhere this tube gets stuck somewhere, and we keep pushing, and the tube comes out. If the tube comes out, of course, now there will be less resistance to the flow of air, and it will lead to a low pressure alarm. So other causes include chest wounds and drains allowing air to escape. Okay, so that means that the total pressure within the chest now is lowered, and then there is tidal volume. If the tidal volume is set too low, it can also lead to such a type of alarm. Then sometimes the physician can put the endotracheal tube, instead of putting it in the trachea, it ends up in the esophagus. That can lead to also a low pressure alarm, because the esophagus typically is a larger opening or lumen compared to the trachea. So guys, those are the reasons why we may have a low pressure alarm and a high pressure alarm. Thank you so much for watching this video. If you found any value, guys, remember to give this video a big thumbs up, and remember to subscribe to this channel. By June, guys, we want to have clicked 1,000 subscribers, and thank you for being part of this community to make that dream come true. And for all of you, have a happy Easter. Have happy holidays and nice celebrations. Bye bye for now.